Greetings and welcome to Village in Motion. I'm your host, Marcia Boyles, and I'm delighted to begin us out this morning with Outpatient Rehab. We're pleased to have Casey Hall as our guest. Casey, glad to have you here today.
Good morning and Happy New Year.
Thank you, and the same to you. You have been a long-term person down at Outpatient Rehab. How long have you been here?
13 years.
13 years, my heavens.
Yes, ma'am.
That must be almost from the beginning of it.
Yes, ma'am. Lisa Clamosa, or Francisco, and I were the first employees hired by Greenspring to serve the rehab department of Greenspring.
All right, well, I had no idea you had been here that long.
Yes.
You are here today, Casey, to talk a bit about the services. It's really a recap of the services you're providing for the new year and something about the financing. So I will let you begin.
Yes, ma'am. Just as a reminder that the Medicare Cap for 2016 has begun as of January 1st and it runs through December 31st. The cap amount is $1,960.
And that's the same as it's been?
Yes, ma'am. Mm-hmm. And the physical therapy and speech therapy are grouped into one pot. So they share $1,960. Occupational therapy has its own cap of $1,960, okay? There are exceptions that they have built in to allowing you to exceed that cap if it is found to be medically appropriate by the therapist.
All right, so one has to then put in an appeal or
basically it is,
exception.
Yes, we take them and we explain to people we are attempt with every effort to be good stewards of people's money and very upfront. If you happen to have an instance where you are having physical therapy and speech therapy at the same time, Medicare constitutes that as an exception to the rule because you would need that. So it depends on the certain circumstances. Certain diagnoses are exempt because of the pathology in nature.
Oh, they are?
Yes, ma'am.
I didn't realize that.
Yeah. So it's kind of individual, and it's something that we cover during the evaluation. And as the year progresses, obviously this becomes more of an issue than obviously the beginning of the year because you are just beginning to accumulate.
Casey, have you had many instances where a person has exceeded the limit?
Yes, ma'am. Unfortunately, there are some years are not as kind to us as other years. So
I think we've
unfortunately,
noticed that.
yeah. So sometimes we have somebody who has an incidence that starts off in January and they notice that they have a little shoulder problem, and then come May, March, they notice that their knee's bothering them, and so that's a repeat performance. Always welcome. However, you know, those are different instances. Or case in point, if you have physical therapy at the beginning of the year and at the end you notice that you might want to have speech therapy by our speech language pathologist, and maybe you need some help with your memory, and that's something that they can help you with, but that too is looked at separately even though coming out of the same money pool.
So it does happen occasionally that
it does.
One reaches the upper limit.
Yes, ma'am.
Okay.
And again, and like you say, there are ways for us to manage it. We're very upfront about the fact that you're coming close to it, or you know, we're going to be able to continue to see you because it's one of those exempt, built-in government systems. But overall, like you say, we try to be very good stewards of everybody's money and very upfront because obviously everybody's worked a very long time and paid into a system, and we want the system to serve you to the best of our abilities.
Okay.
With that being said, because it is a new year, there is a Medicare deductible of $1,066. No, incorrect. $166.
All right,
sorry,
I was going to say,
apologize.
not 1,000.
Yes,
yes.
now, my goodness, I think we're talking mine. No, I'm kidding. So the deductible is $166.
Now, has that changed?
No.
Okay.
That's been pretty standard, and that's for outpatient Med B benefits. So let's say you're coming to us, so they would have obviously a deductible, which deductibles have been around since the dawn of time, so that's not unusual. Let's say that you decide to, you go to the doctor and the doctor says, I would like for you to have a walker. Walkers fall under that same Med B cap, so there is a deductible for that. of $166. So it depends on what you're getting. If you're in Garden Ridge and you get equipment, and we order equipment for you, the therapists there recommend equipment, just so you know there might be a cap. The companies that we use, and of course we are very good stewards, so we will let you know, or the companies that we use will let you know, okay, this is how much it costs, this is your deductible that you have to pay, and then this is the remaining amount that will be covered.
Are there co-pays after you meet the deductible?
It depends on the type of service that you have. Medicare does have a co-pay. However, primarily the majority of residents here have a secondary insurance
Yes, for
that
sure.
takes care. Yes, ma'am. So that usually encompasses that part of that. So overall, most people here are very fortunate that it's taken care of.
Well, you certainly do help folks in terms of putting in the proper paperwork and you know, telling us when we're about to exceed our cap or whatever. So I think, you know, you're just 100% reliable that way in my experience.
Oh, good. I'm glad. We try and we do our best.
Yes,
and if there's a
absolutely
system,
you do.
obviously we try to rectify it as quickly as possible. Just to recap the services that we do provide, we do offer occupational therapy.
Now let's just be sure that folks understand that we're talking about outpatient rehab in Hunter's Crossing.
Yes, ma'am.
On the bottom floor.
Yes, right outside of the conference center, just before the doors that go outside.
It always amazes me the number of people that have no idea where you're located.
Yes, it is very fascinating to me as well, or exactly what services we offer. But it's kind of like
Precisely.
most people, or the majority of people, do know exactly where Hunter's Crossing and the conference center is. So it's kind of like, okay, well then go right.
Right.
And just before you go out the doors, that's where we are. Yes. So occupational therapy is not job performance. Occupational therapy, they are therapists that primarily deal with fine motor and activities of daily living. Okay? So if you notice that you're having problems with buttoning your shirt or picking up items, or you're noticing that your shoulders might be bothering you in the shower, or if you're having problems reaching things in the kitchen.
Navigating the kitchen is,
Most
I think, big one.
definitely, yes. These are things that you can talk to your doctor about. You're going to need to get a prescription from your doctor, whether it be at our medical center or a doctor that you have outside of the campus. You get a referral for that, and then you can set up an evaluation appointment with an occupational therapist to determine whether or not you actually need the services, or there are just some tips that they can give you and that you can continue with those.
Casey, all of the services provided by Outpatient Rehab are through physician referral.
Yes. Yes, ma'am. You need to have a referral, and the referrals can come from a medical doctor, podiatrist, orthopedist. You know, if you are having discomfort and you need to see somebody, you don't necessarily have to say, oh, well, it's because it's my knee, I need to go make an appointment with an orthopedist. If you are doctors at the medical center, or your primary care physician or your internist is probably just as well versed to say, okay, or at least set you on an appropriate path, as opposed to, I know in this area, even personally speaking, calling and saying, I need to get an appointment, I'm having problems with this, and they say, well, how is February 12th?
Right.
Well, by February 12th, I mean...
Well, now, what about the PAs over at the medical center? Can
Yes,
they
ma'am. Nurse
give a referral?
practitioners, physician's assistants. Yes, ma'am. We're
Okay.
all...
And those you can see very quickly.
Yes, you can get those quite readily, and it's the same thing with the outside physicians as well. Sometimes they have those. It isn't necessarily, you know, they just need to clarify that they medically feel that it is appropriate for you to have this, and then the referral can be generated. So that's for occupational therapy. For speech and language pathologist, speech is a very, they have a large range of spectrums of things that they can help you with.
Now, that's all head, isn't it? Or
Well,
above the neck, or...
Yes, primarily it has to do with your swallowing. So they can deal if you're having problems choking, or if you're having problems manipulating, you know, your food or water. Thin liquids primarily is a big concern. Then they also deal with voice and volume, word production, and volume. Voice volume, I think, is quite, you know, people sitting at the dining rooms, that we hear a lot about how you can't really hear the person next to you, or you're
Yes.
having problems. So they can also deal with,
With
the audio,
hearing.
right? Management skills with that. They can deal with memory and cognition. So sometimes
Not
people will
vision.
say, not vision.
Okay,
No, no.
everything.
Yes. So if you're having problems keeping things straight or memory, they can help you with the strategies to manage it.
All right.
Okay, so that's kind of important.
Compensatory kinds of behaviors.
Most definitely,
All
that
right.
can help. So a lot of times, people will come down and they're like, "Well, I'm having problems with my memory," and I'm like, "Okay, so we'll set up an appointment with your physician, referral for speech." And people are like, no, I'm having problems with my memory,
Right.
not speaking. But each discipline obviously has its scope of practice, and speech language pathology is quite broad in the fact that they do memory and swallowing and
Right.
and all of these things that
And
encompass
hearing.
it, and hearing. Yes. So they have the LSVT Loud program, which is a Parkinson's program, where they can help manage the speech quality and volume with Parkinson's patients. Our therapist is certified in that, so that's quite helpful and useful. We have several people going through that program, so that's nice. In regards to that, we also have a therapist in the physical therapy department that has been trained in BIG, which is the Parkinson's physical therapy. So they help with the quality of movement through exercise.
It's a team approach with
Yes.
Parkinson's.
Correct. Right. So we have a certified therapist in that as well, so that we can definitely attempt to serve as many residents with that. Physical therapy also has the program of urinary incontinence, the general ability to treat aches, pains, mobility, walking, balance is a big component. Strength, right. So these are all the things that feed into what a physical therapist might assist you with. Overall, the most important thing is that, talk with your doctor and see whether or not physical therapy is an appropriate, or if you might need to have other medical interventions done simultaneously. Maybe they say, okay, we'll go ahead and start physical therapy, but I also want you to go have an MRI, or I want you to have an X-ray done first. Most of the time they'll do that simultaneously with the referral, and then set up an appointment with us for the evaluation, and then we can help guide as to whether or not physical or what any therapy is appropriate at that given time, whether it be occupational, physical, or speech. So we kind of help decide whether or not those services would benefit you at this time, or set up a plan of care for you to continue.
Do you very often do the whole team approach? Now, Parkinson's you had mentioned.
Right.
Is that?
Yeah, I mean, obviously, being all in the same department, in the same
There are tremendous
office,
advantages, aren't there?
the therapists in the majority of clinics, and definitely here, have always taken a team approach to anything. And even if we get a referral for physical therapy and we're trying to determine something, it is not unusual or uncommon to kind of problem solve or to say, you know what, I am seeing this patient. However, I really think that this patient might benefit from the additional services of. Now, at any time, a patient can say no. However,
Right.
to say that, I don't think it would be a bad thing to get at least an evaluation and a baseline on what we might be able to offer you. But yes, it is quite common to say, we'd be seeing somebody and then just inadvertently a little comment might come up, and it might be, oh, you know what, I'm having problems maneuvering with this. And so it's like, well, occupational therapy might be are the primary people that would be able to help you with that.
Yeah, it really is amazing, the spectrum, the comprehensiveness of the services down there.
Yes.
I think it makes it so much easier for us, and of course it's so convenient just to walk to Hunter's Crossing.
Yes, it definitely makes it easy for everybody just to be able to be located in one place at a stop definitely for the shuttle, whether you use it or not, it is definitely easier.
Now, the Garden Ridge Rehab department is a separate unit.
We are the same department, but yes, the Garden Ridge therapists serve the residents that are staying in the long-term care or the subacute, the short stay. The outpatient clinic actually manages the assisted living units of Garden Ridge.
Oh, it does?
Yes, ma'am.
I didn't realize
So
that.
yes, we manage their services as well. That falls under the outpatient, so they're met by the outpatient department.
Well, you do a good job, Casey, and your department really is just so much appreciated here. It really is quite spectacular, I think. And I think
Thank you.
almost all the residents I've ever talked to who have used it feel the same way, that it just really is superb. Well, I see our time is up. Is there are there any great words you would like to leave us with? Or
No, I'd like to
have you
wish
said them all?
everybody, I'd just like to wish everybody a happy New Year and healthy. And, it's never nice to have to see people, but we're very glad to be able to serve Green Spring.
Well, I appreciate your coming today. I think this was an excellent recap, and we'll see you next year.
Yes.
Thanks so much for
Thank
coming,
you.
Casey. We'll stop now for a roll-in.